Good evening. My name is Toby. I'm a pharmacist for Cypress Pharmacy. And this program, Ask the Pharmacist, is brought to you by Cypress Pharmacy. We have 3 locations, one in Lekki Phase 1 in Lagos, Nigeria, another one in Omole Phase 1, and the third one is in Okwebi, Ikeja. So, like I said, my name is Toby. I'm one of the pharmacists at Cypress Pharmacy. I'll just give you a little bit about my background actually, so you know that, so you feel comfortable and you can ask any questions. So I'm a pharmacist in Nigeria. I'm also licensed in the United Kingdom, and I'm licensed in the United States. And I actively work in those 3 places as locum and especially as a pharmacist in Nigeria. And I work abroad as well in those 3 places. So feel free to ask me any questions. So what we're going to do is that this is a new program we're starting. It's called Ask the Pharmacist. And it'll be brought to you by different pharmacists. But initially, it's going to be, I'll do most of the, I'll take most of the sessions. And later, some of our other pharmacists will take them. So this week, we're going to speak about women's health. And the aspect we're going to talk about is vaginal infection. And the reason why I chose this topic is in the community, whether in the UK, in America, or in Lagos, and this is really geared towards Lagos in Nigeria, we have a lot of people that come in and ask about vaginal infections. And what I've noticed, especially in Nigeria, that doesn't really happen. I've never seen it happen before in the United Kingdom or in the United States, is that whenever a patient comes into the pharmacy and they describe their symptoms, what most pharmacists usually do, and which I find really, really strange, and I'm trying to make sure, we as women educate ourselves so that when we go into the pharmacy, we know the right product that, is supposed to be prescribed for us, is that when females come into the pharmacy, I've seen other pharmacists tell them, okay, buy Ciprotab, which is for a urine infection. And then you should also buy something like CANESTEST, which is for thrush. But the truth is you can't have both. It's one or the other. And I was very happy and glad when I came across this test last time I worked called the CANESTEST. Can you see it? It's called the CANESTEST. It's made by Bayer, and I'm sure most of us have heard of Canesten cream, Canesten pastries. There's so many Cane, all by Bayer. And I think this test is the answer to all that problems we see in the pharmacy when female come in and they say, I have an infection. They're not sure what it is. They give us the symptoms and we are not sure. So the main program is to talk about this test that you can get in the pharmacy. And it's very good because it immediately tells you whether you have an infection, caused by, which is bacterial vaginosis, or whether you have thrush or whether you have trichomonas. So, trichomoniasis, and that way you can easily treat the infection. Okay, so I recommend next time you feel you have an infection or next time you have symptoms, just make sure you ask for this test called CANESTEST, and I'm going to tell you how it works. Okay, so feel free to ask any questions. I'm sorry this program was supposed to be live, but I really, really struggled with my password all morning. I got it ready. I was very happy. I was very excited about today. This is the first live program on on our channel and in our series called Ask the Pharmacist. But unfortunately, for 45 minutes it didn't work, so I decided to record it now, and then I'm going to post it live while messing around with the password. So honestly, I do apologize for what happened. It was my first session and I was a little bit discouraged, but you know what? It's all right. Just one of those things. So here's the test, CANESTEST. So I'm going to open it. It only contains one self-test. It's called CANESTEST, self-test for vaginal infection. It contains one test. I'm going to open it so we all know what we're talking about. And before I do that, I also want to tell you about the 3 types of infection. So if in doubt, you can always go back to this video, or you can Google if you're not sure of what type of infection you have before you use this. This is just the icing on the cake. In other words, you know it's this infection, you know it's bacterial vaginosis, which we all know is BV for short, or you know, you think is trichomoniasis, Hilton blue-green. If it's not, then it's either normal or it's thrush. So, but I need to tell you we need to go over the symptoms first of those 3. It's very easy. 50% of vaginal infections, people get abnormal discharge. But there's also the remaining 50% that you're not going to get any discharge, but yet you have an infection. So the 3 types of infection we said female usually come across in pharmacy, in the community, in retail. Bacterial vaginosis, which we know that's BV for short, and that's more common than thrush. Thrush is also called Candida infection, or is also known as a yeast infection. So first we're going to talk about the symptoms of bacterial vaginosis. I'm sure you've heard some people you've even had, if you've had it before, you know, sometimes you get this infection which has this fishy odor smell. The clue is in that thing called fishy odor. Discharge. That goes without saying, it's bacterial vaginosis. There are other symptoms in bacterial vaginosis. So for that one, the discharge is usually thin, is milky, and it could be whitish or grayish sometimes. And like I said, the fishy odor is the clue. Then we have the trichomoniasis. That has a bad odor. It's not fishy, but there's a bad odor. There's an odor. It's itchy, and then you get pain in the vulvar area upon urination. Then the one that is also common that we know is called thrush, also called yeast infection. And a yeast infection, that one is clear cut. You have thick, cottage, cheese-like discharge. So it's going to be thick. And you know, it forms like cords, you know, like cheesy. And you know how the cheesy, you know, the milk thing or the cheesy thing, you know, how it looks on. Because I've had one of those before. Oh, so gross. And then the itch is intense and it's burning in the vulva area. Vulva means vaginal area. So I hope that's very clear on the 3. So we know what the clue is. For 1, thrush, it's cheese-like. So when you have an abnormal discharge, thick, cheese-like, cordy, we know that's definitely thrush. When the smell is fishy, we know. When the odor, it has an odor that is fishy, we know that's definitely bacterial vaginosis. And the trichomoniasis, that there is an odor, and also there is pain in the vulvar area. Okay, so now we come to this test, this new thing on the market called CANESTEST by Bayer. I suggest every female should have this in their house. So when that infection, because I think I'm going to check the price. I think it's not more than 7,000 naira. I can't remember the exact price. But whenever you have that infection, you don't have to go run into the, you don't have to go and start seeking a doctor, or you need to go to the doctor's office. This is COVID times. We have to stay away. So you can just buy this or have it at home and just do your test. Okay? So I'm going to open this pack actually. So there's just one test. It's a swab. So this is it. This is the yellow bit. This is all this test is all about. So this yellow bit will be inserted in the vulva area, and you kind of, get a good swab. Once you've done that, you allow you get enough discharge or fluid around it, secretion around it. Once you've done that, you leave it for about 10 seconds. If it remains yellow, it means that person has thrush. If they have the thick abnormal discharge, that is cheese-like. If that person doesn't have that and it remains yellow, it means that person is okay. They don't have any infection. Now, if the color changes to blue or green, then the clue is right there. That person has trichomoniasis or they have bacterial vaginosis. Now, the reason why this changes to blue or green is because in those two infections, trichomoniasis and in bacterial vaginosis, the pH is high. And so when the pH is high, the vaginal pH is high, then the color changes. It changes to blue or it changes to green. Okay. In thrush, the pH is normal, so there's no change. And that's why if you have thrush or if you don't have an infection and you use the swab, it's going to remain the same. So this is the answer, the magic swab. Okay, guys, magic. Magic swab. I want you guys to keep this at home, everybody. There's some people that also would have that infect as well, that it might change. The pH of their vagina might change. That is if you're going through menopause, the pH might change as well with this, okay? But that's non-drug, non-infection related. That's just like age. Okay, so that's that. Now, so we've done the test. Do you see what I'm saying? You've done the test. You've used the swab and you now know it's trichomoniasis or so obviously if you have a fishy odor and it's green or blue, then you know definitely. Guys, I know you know the answer, guys. What's the answer? I know that you know the answer is it's definitely bacterial vaginosis. Now, what are the treatments out there for bacterial vaginosis? This is geared towards Nigeria. So I brought some to you. Dalacin. Wow. Miracle drug. Dalacin cream. Clindamycin. It's for vaginal use. There is 7 applicators there. And you use one a day. So all these things, apart from the pills, the tablets, are best used at night. So this is inserted into the vagina, 1 at bedtime for 7 nights. If you have BV, bacterial vaginosis. CANESTEST also has their own product called Cana Balance. I tried getting it today. I went to Boots. They didn't have any. So, guys, I bought the Boots brand. Can you see? It's called the BV Gel. And there's 7 applicators in there. So that's exactly the same as the Bayer brand Canabalance. So Boots is cheaper. If there are any pharmacies in Nigeria, we have it at Cyprus. We don't have the Boots brand, but we have the CANESTEST brand. So I'm going to open this because this is all for you guys. I'm prepared to spend the money so you guys know how it works. I'm not going to open this. It's a bit pricey. So sorry. So can you see there are 7 tubes? You use it at night. You twist the top, push it in the vagina at bedtime, 7 nights. And hopefully after 7 days, the infection should be all clear. So, guys, if the infection is still there after 7 days, unfortunately, I have to tell you, there's no point in you using a second treatment. You need to see a doctor, okay? So we need to know when to see a doctor, when it's out of the pharmacist's hands, We need to practice what we do abroad. When something's out of our hands, we send them to the doctor. Okay, guys. Now, for thrush, for trichomoniasis, there's something called metronidazole gel. Unfortunately, we don't have that at Cyprus at the moment. We'll get it in the next week or so. So you can get it from Cyprus. All this, the CANESTEST, is also available at Cyprus online. It's available in all our locations. And also, it's also available at www.cyprusspecialtydrugs.com. That's our website that deals with rare occasional drugs. www.cyprusspecialtydrugs.com. You find this there. Also find this and the Canabalance. Now, I'm going to talk about the yeast infection, thrush, as it's known. This is a cream, CANESTEST, made by CANESTEST. It contains, sorry, I'm turning the wrong way around. It contains clotrimazole. This is a pill called fluconazole. It's also known as, the brand name is Diflucan. And yes, the one pill is better. Please don't let anybody sell you the 7 pills, which is 50 milligrams. No, it's usually used as 1 tablet, 150 milligram. I'm going to open the pack and you see it, 1 pill, fluconazole. So if you have symptoms of thrush, after you've done the test and you definitely know it's thrush, you just take 1 pill. It doesn't have to be taken at night. There's no time of the day that you can't take this. So you use the pill immediately and you now take the cream. You apply the CANESTEST cream twice a day, or you might use it 3 times a day, depending on how bad the burning and the intense itch. With thrush, you get that intense itch in the vulva area, okay? And you get burning as well. So this is good for that while the tablet is taking effect, okay? So that's clotrimazole. Comes in generic. This is the brand by Bayer, CANESTEST, also available at Cyprus. And I'm sure you can buy it. Look, this is not all about Cyprus. This is about women. I care about the people. I'm a cancer survivor. I want to help a lot of people. Do you see what I'm saying? I've lived abroad most of my life, actually. And what I've learned abroad, I want to use it to make a difference in my country, in Nigeria. Okay? So that's that. CANESTEST cream. You can buy anywhere. Cyprus, your number 1 pharmacy, or any other pharmacy, you can buy it from them. Okay? That's that one. Now, so that's the pills. I've spoken to you about it. Fluconazole. If you forget, watch the video, or you can ask me questions in the comment section. For those of you who have more personal questions, I can give you the WhatsApp number. You can text. It's +234 812 726 7229. I repeat, +234 812 726-7229. It's the store phone, but 3 stores are all on that line. And don't be embarrassed. I'm the only one at the moment that goes around with this phone. Okay, right now I'm abroad and I brought the phone with me. I arrived yesterday, but I brought the phone, so don't be embarrassed. Ask me any question you can, and we'll speak privately, okay? Because I know sometimes some people are embarrassed. It's okay. You know, not everybody's like me. I used to be so quiet when I was young, but now, man, I do talk. And okay. Anyway, so we also have this. If you don't want to take the pill, if you want to use the canesten pessaries is like vaginal tablets. Is inserted in the vagina. I'm going to open this as well. Don't worry, they're not expired. The things I took off the shelf yesterday when I was leaving Nigeria. I took them from Cyprus. Okay. So there are 3 types actually. There's canesten 1, which is 500 milligrams. The one I'm showing you now is, can you see? It's the 200 milligrams. It says 200 milligrams pessaries. So that you use for 3 nights. You insert, this is the applicator. You open the pack and you put 1 pessary, place it on the end, then you insert it in the vagina. You have to do it at bedtime and it's used for 3 nights. Okay? Canesten 3. They're 200 milligrams each. 1 at bedtime, insert 1 into the vagina at bedtime for 3 nights. Okay? That's canesten. There is also the 100 milligrams. The reason why I don't like that is compliance. So just think about it. You have to keep using this thing for 6 nights. I totally discourage that because most patients do not finish them. They do not finish the course of their medication. So 6 nights is really long. So telling somebody to insert this thing for 6 nights, they probably will be put off. So what I usually recommend, I prefer the one dose, which is canesten 500. Chum, at night, that's it. In the meantime, you now apply the cream. So when you use this or when you use the 500, you still have to apply the cream about twice a day because while it's being treated inside, the vulva area is still, it has that intense itch. You have to use this, You have to use this. It's very important. So you don't suffer a lot of discomfort. So apply this twice a day or 3 times a day to the vulva area while the pessaries is working. Pessary is also called vaginal tablet. I could go on and on and on and on. I love to educate people. I love to read myself. I'm from abroad. I now live in Nigeria. But I need to make people's life better. Okay? So that's it. Guys, it's been real. If you have any more questions or if you have questions, don't forget WhatsApp. Okay? Or you can send an email to me at info. Well, not to me, to Cypress, but I'll be the one looking at your email. Don't worry. info@cypressspecialtydrugs.com. info@cypressspecialtydrugs.com. We have 2 websites, www.cypresspharmacy.net. We also have a subsidiary of Cypress Pharmacy called Cypress Specialty Pharmacy. Like I told you, that subsidiary only deals with special drugs, difficult, rare drugs that we carry at Cypress. And those ones, you can only purchase them online. I repeat, only online. You pay by bank transfer. Everything is all online. Check it out. That's associated with big commerce. And that, once you pay, it's linked with our computers in the store. So it automatically knows that we have that product. That's good. It's good for customer, I'm sure. Okay, so also, and next week, I'll be talking to you guys about breast cancer. Yeah, most women don't like to hear about that, but it has to be spoken about. I saw a lump for years and I didn't do anything. So I ended up having stage 3.5 cancer. I didn't really have to go through that stress. So my goal is to prevent, to educate as many women as I come across. Okay? I'm a breast cancer survivor and I have to do something for my community. My cousin, initially I was hiding it, but my cousin said to me one day, Toby, what are you going to do for the people now that you've been through what you've been through? I'm going to change the lives of the people. I'm going to bring change to Nigeria. And guys, next year, or actually this year, October, Breast Cancer Month, we're all going to take part in it. Guys, I know you're going to join me all. We're going to do the 5K run. I usually join and do it in America, but this time we must bring it to Nigeria. We must help our people. We must help all the black women out there. We don't want them dying of ignorance. Like I only had 2 weeks to live, guys, but I'm still alive. I love you guys. Once again, this is Toby. Ask the Pharmacist is brought to you by Cypress Pharmacy. Thank you so much. And I'm so sorry about the network issue. But next time, when we talk about breast cancer, it's going to be life. Okay? Life. Lives are going to be safe. No, we're not going to keep on dying of breast cancer. People shouldn't die of breast cancer. It's now things of the past. So together with our diet, and I'm the wrong one because I'm sweet tooth, we'll all make a change. But guys, you're going to encourage me to give up that sugar, and I encourage you to go for checkups, to test yourself, to check your boobs area, when you have a shower, all underneath, so you don't end up with a lump. Okay, God bless you all, and thank you so much for watching. Again, my name is Toby, one of the pharmacists at Cypress Pharmacy. Thank you so much. Bye now.